A very good morning to one and all who's actually watching this video. I am Dr. JP Gururaj, a consultant psychiatrist at Indranagar Axon Hospital. Today, I thought I should talk about anxiety. I'm sure all of us in our daily lives, currently, at least in the pandemic time, are facing anxiety because of fear of we catching the virus or giving the virus to someone else very close to us, near and dear ones, especially. And anxiety is a very common state of mind people go through. What is anxiety? A state of uncomfortable zone, a state of restlessness, a fear, a belief that something might go wrong. The range could be from a trivial mistake to a major ones. Usually, the major thought process of major things happening, something like death, really can make a man extremely weak, disabled, debilitating. We only treat people with anxiety when the level of anxiety is too high, unlike before, impairing the routine day-to-day functioning, be it a homemaker, be it a professional. It is impairing in his relationship with people, communicating with people. People can identify that he is not at ease like before. One of the common symptoms of anxiety is fear. I always suggest my clientele saying that the word fear stands for false events appearing real. Basically, it is a false event. We imagine it to be true. Just because my heart is beating faster, it does not mean it will beat, and it will collapse and it becomes tired and it will stop. No, it is not like that. We forget that whenever we are running, you watch something happy, your kid is playing, your kid is performing well on stage, you are excited, your heart rate also goes up then, but you don't notice it because you are happy, right? Unfortunately, during anxiety state, like especially like a panic state, the heart rate goes up. Then instead of patient thinking positively, he thinks it is a sign of heart attack or a major illness, he might collapse, right? So this is very, very common during the current pandemic state. How to beat anxiety? Please understand, the first thing of anxiety is accept that you are not like before. Your feelings, your bodily changes are not like before. You might feel the body becoming extremely cold, raising heart rate, difficulty in breathing, sweating, palpitations, as I told you, stomach upset. Something might, heaviness in the chest, something will happen, I will fall down. These are all temporary, right? In a typical panic state, this can last up to 10-20 minutes. We call them as panic attacks. How do you treat panic attacks? Of course, there are medications for people with multiple panic attacks, severe anxiety impairing their function. Otherwise, for routine anxiety, mild level of anxiety, the client or the person identifies that is having bodily changes. What he should do? Just sit comfortably on a chair. Right now, I'm sitting on a comfortable chair. Relax posture. Keep bodily absolutely balanced. Take a deep breath. Hold. The longer you hold your breath, the better it is, because the longer your breath holding, more the supply of oxygen to the heart. Since your lungs are deeply taking deep breaths, it slows down the heart rate. Heart rate is slow, right? The palpitations automatically becomes reduced. You can identify by your own heart rate. If you could calculate using a mobile app or your own digital monitoring of your pulse, you can find that there is significant reduction of pulse rate by deep breathing. So friends, anxiety comes and anxiety goes by itself. One of the most common thing we find people with anxiety is anxiety itself is an hyperactivated state. They react with hyperactivity. Oh, something is happening wrong to me. So they call people, they rush to the emergency, they call up doctors. Doctor, something is happening to me, my heart is going up. Will I die? Is there an heart attack? Should I get an ECG done, an echo done? You find these responses will increase the further adrenergic drive in the body. Whenever there is adrenaline rush, there is increase in heart rate, pulse rate, skin conductance. So body has to go for its physiological changes. So identify it, start relaxing, doing the opposite. Slow down, slow your movements, slow your breath rate, right? If you are walking fast, walk slow. If you're walking slow, stand still. If you're standing still, sit down. If you're sitting down, sit relaxed, eyes closed. Observe your body from bottom to top or top to bottom. Usually we recommend from tip of the toes to your top of the face, right? Relax and just see, observe the body movements. This 5 minutes or 3 minutes of defocus attention will reduce your heart rate and anxiety levels by itself. So, my friends, anxiety is a very common situation. Whatever you see in the media, whatever you see in the near road may not happen to you. Somebody might die at a very young age. It doesn't mean that you are young, you will also die at the same age. No, it doesn't happen like that, isn't it? So, in anxiety, the emotional reasoning and the logical reasoning are never parallel. Fear and logic is less. During logic, the emotions are less. It is a balance between both, right? So, work on, like you call them as work life balance, emotional logical balance is very, very important. So, my friends and colleagues and dear clients, take it easy, keep a smile on your face, stay calm. Time will come, time will go. Tough times come and they become less tougher, right? Initially, I've been told that I can talk in Kannada as well. ಕಲಿಬೇಕಾದರೆ ಬ್ರಹ್ಮ ವಿದ್ಯೆ ಕಲ್ತಾದ್ಮೇಲೆ ಕೋತಿ ವಿದ್ಯೆ. So that's how it is. Once you learn to master the anxiety, it becomes an easy. What was a very big effort becomes less effortful. It becomes automatic to you. So we all can train our mind, train our body, work on training it, right? If the level is too high, you can't, overwhelming anxiety, do consult doctors, to contact your counselor or a psychologist or any friend who appears to be calmer, right? What we find is people with anxiety, talk to people with anxiety itself. So whether they reinforce anxiety, oh please, he died like this, get an ECG done, no, he was so healthy, he was so fine, what happened, he neglected this. So these statements will increase the negative information processing in your body and your mind, and you become much more anxious. So ಕೇಳಿದ್ದೆಲ್ಲ ನಿಜ ಆಗೋದಿಲ್ಲ, ನೋಡಿದ್ದೆಲ್ಲ ನಿಜ ಆಗೋದಿಲ್ಲ, right? So nidana, I think if you stay calm, you have more options. Learn to stay being calm, right? Chill out, my dear friends, and have a nice time and a happy 2022. I hope and I wish and pray that there are no much more ways impairing our lives. I think it's become a part of life, and we have a choice to live our life, and I think it's a choice to stay calm and be happy. Bye bye. Thanks for listening.